based on your experience of treating patients with stroke and managing their lipids to prevention or secondary prevention targets. I wonder if you could share your experience, if you could tell us about a patient that you've treated.
Okay, well, actually I could share a case with you with a very surprising case. So actually, it gave me a surprise. So I have a patient with recurrent TIA. So we give the best medical treatment to this patient, including statin, maximum statin, including double antiplatelet therapies. And all the risk factors have been well controlled. But the patient still have recurrent TIA about one time, one day. So during the hospitalized days, so the patient have the recurrent TIA for the doctors. So we have to face the patient and give the treatment to stop the TIA attacks. So these patients have the LDL-C level 1.2 millimole per liter. So according to the guideline, we have give the target LDL-C level has been reached. So we decide to give more aggressive treatment. So we give the PCSK9 inhibitor therapies. Only 24 hours after the PCSK9 inhibitor therapy, TIA attacks were stopped. So that's very successful practice and very encouraging. So it's very interesting. After the TIA attacks are stopped, the patients will the patient went home, and he stopped these PCSK9 inhibitor therapies by himself because the high cost. After that, TIA attacks recurrent, have repeatedly after he went home. So he have to reuse PCSK9 inhibitors to stop TIA. That's very interesting. So it's very interesting case in my experience.
Shui, could I just clarify a point? You said that the patient's initial LDL was 1.2.
Yeah.
And you decided to use the PCSK9 inhibitor because you felt that it was the main driver for his recurrent TIA.
Yeah.
What did you bring it down to? How low did it go after you started PCSK9 inhibitor?
So we gave the regimen of 1 month twice injection of PCSK9 inhibitor. The dose are only the only dose in China, available in China. So.
And how much did you bring the LDL down to? How low was the LDL after you started therapy?
0.3 millimole.
0.3.
After 24 hours of the treatment. That's really surprised me.
It is very impressive. What do you think the mechanism was for this patient's recurrent TIAs?
So we have performed a high resolution MRI for the patients. The patients have a long stenosis of basal artery and and we can see a long segment of intraplaque hemorrhage within basal artery plaques. So I think it is a very vulnerable plaques. So I think for these patients, we have to give more aggressive lipid lower therapies. So I think PCSK9 inhibitor is a good choice. It's a very strong weapon for urologists.
So would I be correct in saying then that you're thinking that the use of the PCSK9 inhibitor in this patient helped to stabilize the plaque?
Yeah. So just I have said, if the patient have intraplaque hemorrhage or other emerging signs of vulnerable plaque, we will directly give PCSK9 inhibitors plus statin medications because it's very it's high risk for stroke recurrence.
That's a very interesting case. Thank you for sharing it with us.